You see, sometimes when we speak in English, we think everybody understands.
Yeah.
I believe that it is only when we do aggressive education in the local languages of the people that the people will understand. That's why I was saying that the press conference yesterday by the ministry was good, because now they are drawing our attention to the positives, how the areas we should focus attention on. But unfortunately, English and Twi were spoken. What about Ewe? What about Gonja? What about Mampruli? What about all the other languages?
We understand they are translated
this
into
morning,
about 7
are we
other languages.
making any effort to give the information to the people? You see, you fight the pandemic with the accurate information.
Yeah.
So the information must get to the people. You are coming to register to vote. It doesn't mean that come and risk your life. What if on the day of voting you are on admission at the hospital, or you are even dead before the voting? What's the essence of your registration? So you see, people must understand that you are doing it to protect your own self. You are not doing that for anybody. If you are wearing a mask or you are ensuring social distancing, don't ever assume that you are doing it for somebody who. You are doing it for your own self. So if people will not think about their own life and can be reckless because they think that obeying the protocols is doing it for government or somebody, please, government is just a name. If you get a disease, the government will still run. There are countries where the presidents have died. Burundi, their sitting president died before even the elected one was sworn in, but the country still went on. So we should not think that we are obeying protocols for somebody. We are obeying for our own selves.
You know, it's always good to monitor the number of infections. Why? It allows us to be able to identify the spread. How many people have got it in general in terms of the spread of the virus. Then you come to the active cases. Those are the ones who actually have it. How are we sorting them out? How are they going through the challenges they're going through? Then you've got those who have now also recovered. Then you've got the last bit, the asymptomatic ones who don't even express or show signs of COVID. So for me, I think this cocktail is always important for anybody to be able to identify and monitor what is happening. The world, throughout the world, active cases, those who have been infected, those who have recovered, is reported. It's a narrative. Down the road, when all this is over, and we start putting the jigsaw together to write a story, it's all part and parcel of it. I don't think anybody should be scared of the fact that you get infected. What is challenging is that there are quite a number of people who have comorbidity issues who don't even know. Some have blood pressure, some have kidney problems, some have lung problems. They don't know because they don't even show it. Then they get infected and quickly they are into that bracket that they can go. And so it goes to tell us that as individuals, we need to always, after a certain age, we need to always test ourselves. Do I have high blood pressure? Do I have problems with my kidneys? Do I have problems, generally? What is the state of my health? If we are able to do that, when we have a pandemic like this, it's very easy to identify any of those who have comorbidity challenges and isolate them, because that is the difficult bit. A lot of people who have recovered because they don't have comorbidity. But a lot of people who have died because they have comorbidity. So it is a jigsaw, and it is a value chain that at every stage we need to be able to monitor.